Hi again, this is Dr. Paul Davis. I wanted to talk to you about one of the departments we have here at Milford Vascular, which is probably a little bit unique. We have a office-based laboratory, and what does that mean? That is basically an ambulatory procedural suite where we can take care of a host of diseases, not using surgery, but using minimally invasive techniques. And minimally invasive techniques require a skill set, a special skill set that interventional radiologists such as myself would have, or vascular surgeons such as Dr. Esposito. And what we will do is do a host of procedures that will help the patient, and I'll get through that in a variety of ways, without having open surgery. We use the latest technology. We use moving x-rays or fluoroscopy with a very low dose of radiation. We use handheld ultrasounds, and we also use something called intravascular ultrasound, which is a way to look inside the vessel. It's almost like you're looking inside of a vessel from the inside out instead of the outside in, which is very unique. So we'll use all of these techniques to treat a host of diseases and a host of problems. For instance, if somebody has problems with their leg arteries, they have wounds that won't heal, or they're having trouble walking, a lot of the time that is from arteries that are very narrowed or blocked. And it used to be that surgery was really the only way to treat that, or medicines. And of course we will use medications where necessary and where we can, but sometimes it takes a little bit more of a push and an intervention. And we're not talking about surgery, we're talking about a procedure where somebody can come in the morning, have light sedation by our anesthesia staff, and be out in the early afternoon and walking around. There's really no downtime. And what we'll do is make a little nick into a little artery with just a puncture of a needle. There'll be no stitches at all. We will provide a variety of techniques to look at the vessels, diagnose them either with moving x-rays or these special types of ultrasound, fix these vessels either using ballooning or stenting or carving out plaque, or a combination of all of those procedures to help open up these vessels and allow wounds to heal, because wounds will not heal without enough blood, which delivers oxygens and nutrients, or allow people to walk further. A lot of people have what we call, medical is called claudication, which is really just a medical term for somebody who has pain in their thighs or calves when they walk. And a lot of people think it's just because they're getting old or they have tired legs, and it's not necessarily the case. It may be because your arteries are blocked, and we have wonderful techniques and wonderful ways to open those up, again, without surgery, and have you back on your feet the very next day. Again, without stitches, without incisions, without a lot of discomfort at all. Really no discomfort. Most people who leave just take a Tylenol, and that's about all they need. So those are some of the procedures we'll perform in the office-based laboratory, which is just really a name for a mini outpatient procedural suite. There's also, in the outpatient-based laboratory, many patients we will see will have problems with their veins that can be treated not in the hospital. It's a little bit more complicated than an office, but needs some type of procedure suite somewhere in between. And some people come in with large blood clots in their legs that have to be removed, and a lot of times those are not removed in the hospital. There's no need. We can melt them with medications or break them up, and that's easy to do in our outpatient-based laboratory. And again, the patient goes home that very same day with, again, a little nick in the groin or behind the knee to give us access to the venous system and help them with their clots. If somebody needs a inferior vena cava filter, which is not very usual, but sometimes people do need it, and for a variety of reasons. It's a little cage that protects people from getting blood clots to their lungs. We can put that in the procedure room, again, without having to go to the hospital. Some patients who have venous problems, something called a May-Thurner syndrome, or a syndrome where blood vessels can get blocked, sandwiched. There's a way to treat that, again, in the outpatient-based laboratory without surgery, without the need for a hospital. We'll make a tiny nick into a vein under a local anesthetic and either put a balloon or a stent to hold open that blood vessel. The procedure is very quick. The patients are out within an hour or two. So very, very easy. Some patients have problems with their abdominal arteries, either their kidney arteries or arteries leading to their organs. which also can get very narrowed, what we call stenotic. They can have a variety of problems from that. Again, can be treated without surgery, utilizing either a balloon or a stent to hold open those blood vessels and help deliver blood to the organs that are having a problem. So if you or your loved one have leg pain when you walk, leg pain when you're resting, wounds that will not heal, varicose veins that are unsightly or bleeding or of other problems, or other wounds, I want you to call our office. I want you to feel comfortable calling our office, seeing one of the providers, and we will help diagnose you with the latest technology. And to the best extent that we can, we will diagnose your problem and help treat you, mostly with non-invasive or minimally invasive techniques, so that you can have a better quality of life and feel comfortable that you came to the right place for your vascular care.
To schedule a consultation with one of our vascular specialists, give us a call today at 203-418-7386, and it will be our pleasure to care for you.